Overuse of antibiotics puts you and others at risk. A sore throat, cough, and nasal congestion are all common symptoms of a cold, which is a virus that needs to run its course, allowing the body to heal itself, which is what the body was created to do in order for a person to get better. However, there is a surge of prescriptions being written to patients to treat symptoms that are caused by viruses, not by bacterial infections, which is what antibiotics treat. In today's society, there is a heavy reliance on medicine. Yes, antibiotics are needed to treat severe bacterial infections, but the overuse of antibiotics create antibiotic resistance, which becomes a major danger for the population. Before antibiotics were discovered on accident by Alexander Fleming, simple bacterial infections would often be deadly as there was no antibiotics to treat it. This risk is on the rise yet again as there is no way to treat bacterial infections once they become resistant to antibiotics due to overuse. Antibiotics are used to fight bacterial infections. They do not fight illnesses that are caused by viruses, such as colds and most sore throats. Research conducted by the Center for Disease Control has shown that 1/3 to 1/2 of antibiotic use is either unnecessary or inappropriate, meaning that each year 47 million unnecessary prescriptions are written. According to the Centers for Disease Control, 2 million people annually acquire serious infections with bacteria that are resistant to one or more of the antibiotics that were designed to treat those infections, and this resistance is caused by using antibiotics when not necessary. Drug-resistant infections result in more serious illness, more death from previously treatable illnesses, prolonged recovery, more frequent and longer hospital visits, more doctor visits, less effective and more invasive treatments, and more expensive treatments. Many things contribute to the cause of antibiotic resistance. There is a lack of new drug development, so the same antibiotic is being prescribed over and over, which causes resistance. There is an overuse of antibiotics, especially when it comes to taking antibiotics when they are not appropriate, which can come from doctors prescribing antibiotics before receiving test results, from people wanting a quick release and pressuring the doctor, from people taking antibiotics purchased either online or abroad, or from someone taking someone else's antibiotics or leftover antibiotics. In cases when antibiotics are being taken for a viral infection, the antibiotics can actually attack the good bacteria, being harmful to the body. According to the Mayo Clinic, bacteria can transfer drug-resistant properties to other bacteria to help each other survive. People are very quick to take medicines as soon as they begin to feel pain or sick. This is interesting because all throughout the Bible, it talks about how Jesus healed the sick and raised the dead. He is powerful, yet instead of praying to him, asking him to heal us, we go first to the medicine cabinet. In James 5:15, it says, "And the prayer offered in faith will make the sick person well, and the Lord will raise him," which is a perfect example of the power Jesus has to heal us. If we pray and believe earnestly that he can heal us, Jesus can. In order to prevent bacteria evolving into something no longer treated by antibiotics, it is important for patients not to demand antibiotics from the healthcare provider when they say they are not needed, to be cautious not to take antibiotics for viral infections, and not to take antibiotics prescribed to someone else. In conclusion, it is important for society to realize the risks that come along with the overconsumption of antibiotics. There have been so many unwarranted deaths due to bacterial resistance. The overuse of antibiotics is dangerous to an individual and society's health. Patients and physicians should be careful in considering the prescription and the use of antibiotics so that bacterial resistance becomes less, preventing a superbacteria and major illness in the future. Thank you.